Over the last year or so, we've heard a lot about the Zika virus. At first, it seemed like something that couldn't affect us here in the States, but now there have been reports of babies being born in the U.S. with birth defects caused by the virus. So what can we do to protect ourselves? Dr. PORCHE with Lake Area Medical Center is joining us. Maybe you can put our minds at ease a little bit by just starting out and telling us what Zika is.
So Zika it's a virus. Usually you'll have a rash, fever, maybe red eyes. It's not very serious. Symptoms sometimes will last a week or you won't have any symptoms at all. The big deal about Zika is that if you're pregnant or get pregnant shortly after getting the virus or obtaining the virus, then it can be very serious for the baby, causing neurological defects.
So if there are no symptoms, if you're pregnant, should you just automatically go and get tested? Or
so right now, the CDC updates their recommendations all the time because all of this is new. The recommendation right now is that if you've been to an area with Zika there, so South America, Africa, as well as India, then you should get tested. So definitely if you've been in that area and became pregnant shortly after, you should get tested.
We've heard about some babies being born in the U.S. with birth defects because of the Zika virus. So were those people traveling to areas affected, or were areas in the United States affected by Zika?
Majority of those people, or all of those people, were traveling to areas where Zika virus was. There have been 2 states in the U.S. that have had Zika virus infections, Texas as well as Florida.
All right, pretty close to us. What can we do to protect ourselves?
So the recommendation is to wear bug spray with DEET, and also avoid areas with lots of mosquitoes, which is tough in Louisiana, but stay in air-conditioned areas, especially if you're planning on having a baby in the next 2 months or are currently pregnant.
Now, what you were telling me earlier during the break is that this is only going to affect the baby if you're bit and infected while you're pregnant. It's not something that lives dormant in your body.
No. So from what we have gathered so far, once you're immune to the virus, you shouldn't have to worry about it afterwards.
And how long is it live within your body? How long are you sick with Zika?
Usually not more than a week, or you may not feel anything at all.
You might not even know that you have it.
Correct. So another important thing is if your because we saw in Texas it can be sexually transmitted. So if your partner goes to a Zika infected area, you want to be careful of that as well.
All right, so we actually have multiple ways that we can be infected with Zika, but the most important thing is to be aware if you're pregnant or you're trying to get pregnant and you're traveling to other countries.
Absolutely, yes.
All right, how often does the CDC update the areas in the United States that are affected by Zika virus or those mosquitoes?
They have been really on top of it, and sometimes the updates are as soon as every week. So if you're traveling or you're planning on getting pregnant or currently pregnant, I would visit that website every week or so.
Especially if you're planning to travel, for sure. Mm-hmm. As we're moving into the summer months, of course, it's going to get hot and we're going to have more and more mosquitoes throughout the area. If somebody needs to give Lake Area Medical Center a call with questions about Zika, can they give you a call?
Sure.
You're our expert for the area. We've got the number there on the screen for Lake Area Medical Center if you'd like to ask Dr. PORCHE some questions about the Zika virus. Thanks so much for coming and calming our nerves a little bit.
Thanks for having me.